السلام عليكم ورحمة الله وبركاته. معاكم دكتورة هبة شفيق. هكلمكم النهاردة عن الريبس. Rabies is a rapidly progressive acute infectious zoonotic disease. Rabies or سعار مرتبط بالanimal bite to the humans and affect the central nervous system. The virus itself is sensitive to chemicals as ethanol, iodine, soap, detergents, ether, and destroyed at 50 degrees centigrade in 1 hour and at 60 degrees centigrade in 5 minutes. Reservoir: dogs, cats, whether it is domestic or home, pets, raccoons, chunks, fox. Actually, most vertebrates can harbor the virus. Source of infection are saliva of rabid animal. In dogs and cats, the virus is found in their saliva 3 to 4 days before the onset of symptoms, which means that the animal seems well and good, and actually he is infectious. Mode of transmission: rabies virus replicates in acinar cells of salivary glands and transmitted by the animal bites or licks to injured skin. Skin have some scratches or aerosols from the nose. Also, when it touches a non-intact skin, scratched or crackled skin or mucous membranes. The incubation period, which is the interval between exposure and the onset of the clinical disease, usually 20 to 19 days, means 3 months, and maybe up to 1 year recorded. So it may be forgotten, especially if the bite is so small, or just the dog licks his skin when he playing with him and there was injured or non-intact skin. The pathogenesis: the rabies virus spreads centripetally along the peripheral nerves. So it starts in the peripheral, takes the road of the nerve from the peripheral till reach the central nervous system. After becomes established in the central nervous system, he will distribute to the autonomic and sensory nerves in the heart, in the salivary glands, in the adrenal glands, in the skin. Negri bodies. This is negri body. This is a term pathognomonic in biopsy to the virus lesion and composed of eosinophilic cytoplasmic inclusions in the brain neurons, and it is composed of virus proteins and viral RNA. This is diagram showing the cycle of bite of the animal, travels across the nerves, peripheral nerves, to reach the CNS. From the CNS, it will redistribute to the salivary glands, to the heart, to the lung, whatever. The clinical picture: the first one is the prodromal symptoms, which is a non-specific symptoms, includes fever, malaise, headache, nausea, vomiting. No one could expect that he has rabies. Anxiety or agitation and pain at the site of the bite. He may feel some numbness and pain at the site of the bite. All of them, and maybe pruritus, all of them can't expect that the patient has rabies unless he known that he had get a bite of an animal, and maybe he could be raped. But if the history is unclear, especially children in mentally retarded, and we can't expect the diagnosis at all. The second stage is encephalitis or encephalitic rabies. It has two neurological forms. Encephalitic form, it is 80% in 80% of patients, and paralytic form in 20% of patients. Encephalitic rabies, the manifestations include fever, confusions, hallucinations, and seizures. Hypersalivation, cardiac arrhythmia, this will also can be presented. These episodes of hyperexcitability are typically followed by periods of complete lucidity. If the patient exposed to he want to drink, he will complain of involuntary painful contractions in the diaphragm and in the accessory muscles and in laryngeal and pharyngeal muscles. So he will be feared of drinking water, and this called hydrophobia, and maybe even to the aerophobia. Flashes of light may make him hyperexcitable or agitated at this stage. The paralytic phase, someone not comes with a hyperexcitable phase. He comes with paralytic one, and in this there is muscle weakness and maybe sphincter involvement, maybe sensory involvement, and he may complain of quadriparesis and facial weakness. Actually, paralytic rabies commonly misdiagnosed as Guillain-Barré syndrome. Patients with paralytic rabies generally survive few days longer than encephalitic rabies, but actually both of them are fatal and end with this. The complications: patient may die from cardiac arrhythmia, from respiratory failure, from endocrinal and disturbance in the water balance with inappropriate antidiuretic hormone secretion, maybe non-cardiogenic pulmonary edema or gastrointestinal hemorrhage. Laboratory investigation, all of them are non-specific. Even CSF analysis may show mild mononuclear cell pleocytosis, and if there is severe pleocytosis and you suspect rabies, you should review yourself, as your diagnosis may be mostly fault. CSF is usually normal. CT scans can't diagnose rabies. EEG can't diagnose rabies. MRI, all of them can't diagnose rabies. Diagnosed rabies, because of that, is so difficult without history of animal exposure. Some said that skin biopsy near the nape of the neck, at the base of the hair, may demonstrate rabies virus antigens, but this is hard. Even if we take the animal after his death and makes slides of his brain tissue and diagnose it pathologically and doesn't demonstrate negri body, don't exclude rabies to the patient. The treatment, no established treatment. It's only supportive care, and it maybe prolong the patient's life. So if you diagnose rabies late, the patient it's hard to survive. The prognosis is fatal, as we said before, if we don't give the appropriate post-exposure therapy during the early incubation period. The post-exposure prophylaxis. This is the only way to save your patient. Healthy cats and dogs, if you have a domestic cat or dog and he is vaccinated and well, can be observed for 10 days with just care of the wound, and don't start post-exposure prophylaxis. But if you don't know the animal, or you are not sure that he is well and good, you should start post-exposure prophylaxis as soon as you can. This consists of local wound care, all the bites and scratches should be washed thoroughly with soap and water, devitalized tissue debrided, tetanus prophylaxis is given, and antibiotic if indicated or if needed, whether topical, غالبا هتبقى topical if the wound is not damaged severely and needs systemic antibiotics. The immunization, there is passive immunization for rabies immunoglobulin. The rabies immunoglobulin is injected around the wound, and it should be started not later than 7 days after the wound. Actually, you do both things. You do the first dose of the vaccine, and it is given at the deltoid region, and you inject the rabies immunoglobulin around the wound. It may be diluted or may be not diluted according to the area, the size of the area, but سواء الوند كان كبير أو صغير the dose is the same. 20 international unit لكل كيلوغرام, 20 international unit for every kilogram. If exposure involves mucous membrane, the entire dose should be administered IM. This is for rapid immunoglobulin, which means that if the wound was in the mucous membrane, you will not inject the rabies immunoglobulin around the wound, but you inject it intramuscularly. Rabies vaccine and rabies immunoglobulin should never be administered at the same site or the same syringe. Shouldn't be mixed with each other. Purified and activated vaccine is available for 1 millidose of rabies vaccine given intramuscular in the deltoid area. Gluteal injections are not permitted and associated with vaccine failure. The 3 additional doses will be given in day 3, day 7, day 14, and the 5th dose are no longer recommended, which was given at 28 days. Pregnancy is not a contraindication for immunization, but glucocorticoids and immunosuppressive drugs are makes the immunity disturbed, and it should not be given at the same time. Thank you for listening.